Hello, everyone.
Hello, everyone. A very good evening to all of you. Good afternoon, good morning, good evening, wherever you are.
Yeah, very early for Dr. Jigyasa as well.
Yeah.
So,
Thank you for being with us in early hours.
Hi, hi Dipesh. Hi Kanika.
hello, how are you?
Hello.
Good, good. Thanks for having me.
Wonderful
Most
to have
welcome.
you as always. We are just in the middle of
Adding few people.
adding a few people. So
Sure.
we might just wait for a few more seconds and then start. In the meantime, welcome everyone. Thank you so much for joining us and enjoy the view on the slide at the moment. And we'll start momentarily. We'll start very soon. Can everyone hear us?
Yeah, that's good.
Yes. So yeah, I think that's good. So it's all loud and clear. Nice. I think still admitting a couple of people. What time is it there, Jigyasa? Early morning for you.
5:30 a.m.
Fair enough.
But
It's
that's my
coffee.
usual working time now.
Awesome.
Yeah.
Coffee time. Breakfast
Yeah.
and coffee.
Right.
Yeah. It's about 7:30 here in Australia, Melbourne. Um,
Okay.
so yeah.
Yeah,
Nice.
I would know. I mean, I work Sydney time, so yes.
Yeah, nice. All right. So I think let's start. If
Yeah.
anyone else comes in, we'll join them.
Yeah.
So just bear with us if we are distracted a little bit, but we'll try and be there as much as we can.
Sure.
Now, welcome. Good evening. My name's Dipesh.
I'm
I'm
Kanika.
I'm here with Kanika and Dr. Jigyasa as well. Um, I'm lucky to have wonderful ladies with me today who are very good at what they do, and together we are Winspert and Team Dental 101. So Kanika and myself are from Dental 101 in Melbourne, Australia, and Dr. Jigyasa is from Winspert. She looks after all the Part 1 ADC, and she's doing a wonderful job. She's been doing that for a few years now. And what we are trying to do today is essentially give you just a bit of an introduction about the ADC process. Obviously, you're all here for that. Majority of you are here for part one, and recently, whatever the changes that have happened. So we'll go through that in detail. Dr. Jigyasa will take all your questions as well. So if you have any queries, any questions, can you please put them in the chat box? And we'll look at them once we are through with the part one part of the presentation. If we feel that anything is relevant on the topic that we are talking about, we might pick that up straight away, but we'll cross that bridge when we get there. And yeah, that's about it. So let's get cracking. Um, this is Australia, and I'm assuming that a lot of you are already here. If not, you are overseas and you have an aim and trying to study or make a life abroad, so which is wonderful. We are testament that it works. It is amazing. And yeah, we'll just go through that. So welcome. First of all, in these trying times, I just want to say that wishing you all are safe, healthy, safe and positive vibes to all of you and your loved ones. I do wish that it all gets better soon. It's not something that we are anyways looking forward to. So we have had a lockdown in Melbourne today, and it's not pleasant. So yeah, it's something that we are trying to get over. All right. So just give me 1 second. Who we are and why we are here today. So Dr. Jigyasa and us, we are a group of passionate and motivated professionals, health professionals to be exact, and we are trying to help individuals in all aspects of their professional journey and to achieve their goals. You could have different motivations, you could have different plans as to why and how you want to do this. But I do feel that with Dr. Jigyasa and us, we share the same passion. We share something that is a desire to help individuals as much as we can in making a life. So that is what we are trying to do here. Together, we have quite a few decades of experience. We have been doing a Dental 101 helping people since 2012, and Dr. Jigyasa has been helping for quite a few years as well. And yeah, we love doing that, and we are here for you in every shape and form. We provide end-to-end solutions for all your professional needs. So it's not just part one or part two, it is everything related to your professional journey. So before, during, and after. And we are quite proud of that fact. So we'll go through that briefly as well, but the main focus today will be part one. That's just me, a little bit of introduction. So I'm a Melbourne University graduate and we do a lot of things. I'm a private practice owner as well, and work with the Defense Force and co-founder for Dental 101 along with Kanika here. With Kanika, she is the backbone. Once you get in touch with us, Kanika is the one you'll be in touch with most of the times, as with Dr. Jigyasa. And she has over 15 years of teaching experience, and she is the one who looks after everything. So Kanika is there.
Talk to everyone maybe once you've done your part one journey and once you start with your part two. So I'm sure I'll come across a lot of you.
And that's wonderful, Dr. Jigyasa. She began her journey as an aspirant, but now she has cleared the exam, and she's doing what she does best, helping and guiding a lot of students. She's quite passionate about teaching, and I'm sure that you will be in very, very good hands. She's also doing her Canadian exams. I think she has done a part of it as well. So that was also going to be down the track. And I think once you hear what she has to say about part one, I don't see it as a problem that you would find, doing that.
Dr. Jigyasa can add something.
Yes.
We have introduced you quite well, I think.
Yeah, that's good enough. That's too much actually. I'm a little bit of what you've said. Yeah, but one thing is really true, that I'm totally dedicated here for my students, and today also I'm doing it, those who are my students and those even who are not. But with this changing times, and not just speaking COVIDly, but also the ADC bringing the new change. So I think it was a much needed and a very well timed orientation class.
Yeah. So
Yeah.
there you go. Now, this is just something that I wanted to put across, because we get this question a lot, that COVID and what happened, and everybody prepares for it in their own way. We do whatever we can, but there are some things which are not in our control. But as long as you are well prepared, eventually things can get better, and you'll all be doing whatever you need to do. And just keep putting in the effort, be with the right group of people, have the correct guidance, and we are sure that it will all follow through.
Yeah, and that's what we noticed with people who didn't stop practicing during COVID, because of course everything was very uncertain, but still people were practicing, still cutting teeth, preparing, for part two exam as well. And that's all their hard work paid, and most of them passed in first attempt. So that doesn't, like, we don't see the behind the scene hard work they have done during that time as well. They never stopped, so they continued practicing, they kept going, kept themselves motivated even though they didn't have exam dates, and that the result is that they came out with flying colors.
One last thing that I would like to add is that I would like all of us in this presentation to actually believe that we are on the right pathway. You are all professionals, you are all dentists, you are maybe new students, maybe recent graduates, or maybe you haven't had experience in a few years. But you all have that doctor in front of your name. So believe that and approach the exam in that way. If you act and behave like a student, the result would be that. If you act and behave like a professional, then it would work that way. So that is just my 2 cents, and that is, I believe, is something that everyone should do it in that way. So just briefly, so we help in all aspects. So before, during, after, as I said, with immigration as well, we help you in surgery support, financial advice, English exams once you clear, and part one is with Dr. Jigyasa in collaboration with her. So anything and everything that you need to have a successful life, we can do that, and even helping you with jobs afterwards. So we'll talk about part one, part two, part one mainly, part two very briefly, and something a little bit more as well. And hopefully that helps you all. Winspert and Team Dental 101. So obviously that would be the success. Thank you, Dr. Jigyasa. Over to you.
Thank you so much, Deepesh. Thank you, Kanika. So I know this is the first time that in an orientation class, you would already have doubts because of the given sudden announcement of changed in ADC pattern, right? So I expect everyone to already be, the minds flooding with doubts and confusions and of course some insecurities. And probably I'll try to explain all the changes. And also maybe we will be talking about that how your preparation would or would not change as per that, and why those changes in fact may get beneficial to you in long run. So so I'll start to give you an introduction. I'll try to cover as much as of the changes as well as how the preparation should be and how I can come handy in preparing those. And then towards the end, I'll take your questions as they would be. So let's begin the initial assessment. Everyone knows there are 3 steps. You will have to gather the information. You would have to go on the website, know what are the documents that ADC requires to assess your qualification in your country. And of course, the specifications would vary as per the different country that where you come from. So definitely it is something which can get a very personalized experience, but ADC is usually very interactive and they're very responsive if you email them and ask them your doubts. And of course, I can also come handy in for basic information, but usually because it's country specific and ADC requires and has very specific needs about the documents. So being in touch with ADC and through email, it works really best, is the best way to approach it. After you're done with your initial assessment process, of course, then you move on and then you start preparing your part one. So Deepesh, can you just change the slide or
Yeah.
Give me the remote, probably. I'll just switch the slides. Okay, so if you can give me the remote access, I can.
I did that, yeah.
Yeah.
All good?
Yeah, no, I don't think I've gotten.
Yeah, you did. It's just an arrow on the, yeah.
Yeah, I see it now. All right. So once your initial assessment is done, now the part comes where you have to prepare for the written examination. And what comes first to your mind is whenever you're done, or even when you're going through your initial assessment, is that how much time am I going to take to prepare for the exam, right? That is the first thing that person would need, right? The time on their hands. And because it is not like you are intern or you are just a pass out or you're a BDS graduate, just immediately, in a student life or making a transition into a professional life, that you have all the time on your hand to prepare just for this specific exam. Most of us who are taking this exam would be having families and would be having a professional commitment, already working either their own practices or as associates. But yes, we have professional and personal commitments, the family commitments, which take up most of our time, right? So considering that, that is what actually makes this journey a slightly challenging. I would say the studying part is not challenging if you have enough time. It's the other commitments and being distracted by your life in general that makes it a bit challenging. So basically what you do is you set aside, and what it needs is just a little time management and discipline and setting your goals in a way, following a plan. Because I always help my students to give a daily plan, then a weekly plan, and then a monthly plan. And based on that, we build upon everyday, curriculum. And then that's how we approach the exam. So it usually takes about 5 to 6 months. And given you're spending about 5 to 6 hours, every day, suppose you're not able to spend those many hours, I've had students who have covered it and cleared the exam also in less hours, but then you have to really tailor the course and tailor the material that you will be studying. Usually, optimally said, it is 5 to 6 hours and for 5 to 6 months. You can do in less. Of course, it has been done. I have evidences, I have testimonials, real people's messages, and it has been done. And also some people like to take some time. It also depends on your personal pace of grasping the concept. So that can stretch you to about 10 months as well. So a lot of students also do 2 courses with me instead of 1, because they have maybe more commitments, or they would just want to take it slow, or it is your personal way and speed and pace of approaching things. And every method is perfect. There is no one size fit all. Individual has individual approaches, right? And after you clear your part 1, and then eventually you go to your practical examination, which has now become even more, in fact, it's a very good examination process. They assess you not just on your skills, but also on your clinical acumen by your OSCEs. So it's not just your muscle memory that they're testing anymore. They are testing you how the muscles here work as well. So you just don't need to practice 3 months just like a dummy. You really need to understand the patient, the management, the diagnosis part. Yeah. Now, the good news to that is even your part 1 now has come to, align with how the part 2 is framed. So everyone knows the written examination happens twice a year, March and September, and you need to get your assessment done well before that. And so the revised written examination pattern, that is everyone's concern today, that how it has changed, whether it's for worse or for better. So actually, I'll give you my verdict towards the end, because I want you to derive your verdict as well as we go through it, because it will all come out to you. It will surface to you that what has been done and how it's going to serve you. So the examination structure is basically same. It is happening 1 exam over 2 days. And instead of having 2 papers per day, initially what they were defining as papers, where they had subcategorically put subjects underneath, now they have put it as 2 sections per day, where they have actually blurred the lines of subjects which would be asked under one section. So earlier in paper 1, they were confined to your endo and operative and your caries. Now and then your paper 2 would be prosto, paper 3 would be your surgical anesthesia, etc. And then paper 4 would be your periopedo, etc. So now they have actually blurred all the lines in the segregation of subjects. And in fact, I would be telling my students from a very long time that they have actually blurred the lines already. It's just that they have come out and exposed it. So they were already snipping away and, sliding away questions of different subjects in the different papers. And we were already approaching the preparation in the terms of interdisciplinary way. Yeah. We were concerned about the prosthetic implications on perio, the perio implications on prosthesis, the removable prosthesis, the operative and restorative implications on the perio health, and then the oral medicine information, your general medicine information, how you can identify the oral manifestation of systemic disease. So all were infused actually already together, and it was never very demarcated to begin with. Now they have come out and exposed it. They're not obligated to put majority of those subject questions anymore. They have diffused those lines. It's section only. Section 1, 2, 3, and 4. And that is any subject can be asked under those sections. Simple. And they were already interdisciplinary for that matter. So now earlier they were defining it like subjects and domains. What is this term domains and disciplines? So they have used the term discipline for the subjects. For discipline means your various clinical subjects like your endodontics, your prosthodontics, implantology, pharmacology, oral medicine, general medicine, and your periodontics, and so on. All your clinical subjects of dentistry are your disciplines. And now they are asking, and they were already asking, interdisciplinary questions. That was a given. Now the domain is that what aspect of that discipline they would be judging you on. And just like your OSCEs in part 2, now they would be judging you upon your professionalism, your patient management. They will be also judging you on coming to a diagnosis, and then eventually planning the entire treatment of the patient, and then also monitoring, recalling, and reviewing the patients. These are the 4 or 5 domains under which each Sbq, as you say, the scenario-based questions, would be framed. And earlier, it was just the same. Now they have opened up more about how they define those questions or the criteria. Nothing would be changed in terms of how the questions are being asked. It was already going on from the years that Sbq started, right? They have just come out and put a name on those criteria, right? So for you, it is better because now in part 1, you would have that open-minded approach to preparing each discipline under that domain of professional management, prevention, because every disease would have preventive procedures. Every discipline would have preventive methodology, and then diagnosis, treatment planning, what are the tests, what are the etiological factors, and then what should be your treatment plan and management, and then how you go about and review and recall the patient. So this is exactly what you have been doing in your undergrad or your postgraduate for that matter, right? So it's just that they have opened up and they have come out and said that, put a label on something which was already existing. So you have just defined methodology, simple. They were already doing it. So they're not changing anything. They're just coming and talking about it more openly, as I would say, right? So disciplines and domains would be mixed across the sections. First, also, as I said, domains were mixed across papers. So they were talking about domains already, but under specified disciplines under papers. Now they will be mixing the disciplines as well. Earlier, they were only mixing the domains, right? The etiology and everything was already asked under prosto, endo, and likewise. Now, the number of questions have been chucked down from 320 to 280. So individual paper initially had 80 questions. Now individual section would have 70 questions. Makes sense because they have dropped out MCQs. So if they have dropped out MCQs, so let me put light to some facts. From I think when I took the exam in 2017, since then I can totally vouch for. And before that also, because we had past papers and files. So already ADC was doing 70 questions Sbqs and about 10 questions MCQs, give or take plus minus 1 or 2 questions. Already they were doing 70 Sbqs and 10 MCQs approximately. And now they have eliminated the MCQ component from the paper. So you're actually left with 70 questions. Just putting it in a perspective so you know that there is nothing new that has been added, but rather old has been taken away. Yeah. Some part of it has been taken away rather than new being added. So some reshuffling and elimination. I don't see anything new coming in. Not at all, not yet. Just reshuffling of how disciplines were asked and elimination of MCQ pattern standalone questions. Simple. Although they give here that it was 50% previously and 50% standalone approximately, knowing the pattern and knowing the trend, it wasn't so, right? And passing requirement earlier was for each paper, you would need to clear each paper to clear this exam. Now they would be giving you the grades based on the clusters, and the clusters are defined by domains. So there are 4 clusters. One domain, each cluster contains each domain. So let me just go to that slide first. So you also have. Yeah. So now the grades would be based on these 4 clusters. Instead of being judged on how you performed for each discipline, or rather how you performed in each section, this is a far more, I would say, far more intelligent way of grading you, because because now the subjects are fused, right? If they give you pass or fail in one section, you wouldn't know which subject you were weak at, or you wouldn't know which subject you were strong at, right? So section, because it has random arrangement from all the subjects or disciplines, as they say. So that is why if the grading by section wise wouldn't be a wise method to guide a student to improvement. Whereas if they grade you based on the cluster, which would be based on the domains, which would be like your cluster 1 would be professionalism and health promotion, how you help and apply answers to your preventive questions and approaching the patient. Then cluster 2 would be your clinical information gathering, how you collect and make sense of the history, then derive your etiological factors, what are the possible tests that you may be doing for those patients. And cluster 3 would be judging your acumen based on whether you were able to derive the correct or most likely diagnosis and some plan the management around that. And then cluster 4 would be judging you around what was your treatment that you conducted, was that conducted correctly, and then whether did you evaluate that treatment for your patient and or not. So these are the criteria. Now, when you get grades based on clusters, at least you would know, no matter what subject I may be weak or not, but at least I know if at all I have to improve my next score or next time, God forbid, if you do not clear, then at least you would know what domain you're weak at. Are you weak at preventive techniques? Are you weak at your professional guidelines, which are required in Australia? Or are you weak at understanding the keywords and the history that is very tricky and is such a complex language that you would be like lost in a long novel? So that's how it is. Are you able to pick up the keywords from the history and derive the correct meaning? Can you gather the information? Are you weak at knowing what the collective meaning of each history means and what the diagnosis could be? Or are you weak at planning the treatment and the patient follow-up? At least you would be knowing where your weaknesses are. And that's extremely important because you cannot improve what you do not know. That's right. Yeah. So you cannot work on and you cannot improve what you do not know or you're not aware of. So it would put your performance also on limelight and highlight that where you're strong, where you need improvement in case you need to redo.
Similar to part 2, what we have currently.
Yeah.
Yeah. Similar
Exactly. That is what it does. So that's my next point, that it has brought you closer in the mental aspect. So those 5 to 6 months, you would in fact be now trained to think like as you would be in part 2.
Yeah.
So it's in fact more bringing you towards and making part 1 and part 2 preparation more coherent.
Yeah.
Now your part 1 preparation would be more coherent. It would be more influencing, more supportive, more effective, and also creating a very strong foundation for your part 2 preparation.
Yeah,
exactly.
Right. So now the scored and unscored items is one thing that might confuse you on the website, which is that out of 280 questions, only 240 will be scored and 40 will not be scored. But I would say you will have to kind of block out this information, because you will not be attempting the exam based on, oh, I might get lucky with this question. This may not be scored one. And then you may be sub-performing for every question like that. For you, you need to believe that I will be judging based upon all the 280 questions, because those 40 questions are not being scored, but they tell that they are for calibration and testing. So somehow it will affect your result.
Yeah.
So you just forget this fact and just take it with a pinch of salt. All 280 questions matter to you and will impact your result straight. So passing requirement would be you will needing A or B grades in these 4 clusters, and C and D grades would be fail and A and B grades would be pass. So when you do that, earlier there were 5 grades for A, B, C, D, E. Now they would be 2 grades. But I think the passing criteria still remains the same, just they have divided the scores over broader range now, and divided into 4 grading system rather than earlier being 5 categories. But the passing score or the cutoff would more or less remain the same, because obviously the competition is studying as you are. So you would have to be in the top percentile. For any exam in such areas, whether the licensing exams for almost all the countries follow the percentile criteria to allow the dentists in their nation for that period of time. So you believe that you have to be in the topmost, whether for part 1, it is roughly being in part 30% of the crowd. And for your part 2, you have to be in the top 20% of the crowd during the given scenario. So that's what it is. I mean, they will take up the cream. They will take up the cream. So you got to be in the cream. You may be good. You made it your best, but others' best was better than yours.
Yes.
Yeah.
Right?
100%.
Simple. The fact and science is simple behind it. Some people think that I did my best. What did I not do? You did everything which was your best, but maybe other people's best was better than you on that day.
Exactly.
Specifically 30% of people performed better than you that day.
Yes. Yeah.
As in your part 2, if 20% of the people perform better than you that day, right? So then they make it. So the top 20% performers, top 30% performers, they take away the cake. That is how it is. So whenever you're studying and you think that you're distracted or you may not be doing your best, that is one cue that it is not enough. If you're distracted, if you're wondering, and if you think it is not my best, but still it may help me, it's not enough. So sometimes the better version of your best version would be required.
Yeah.
So this is the only challenge with this exam. It is not difficult. Information that you read is not difficult. The challenge is you have to outperform others. Simple.
Yes.
Now, where the preparation comes, as in my part, so we offer ADC Part 1 course, and which is either, so the basic course for every March and September exam begins in, for March, we begin in October, and for September, we begin in April. And it's a 5-month program, 22 weeks program, more or less. And some students join for 5 months, some students join for 10 months. And based on that, either you do a 5-month program or a 10-month program. And then there is quiz series as well, where you would be taking quiz for individual subjects. And then along with that, there will be about 3 live classes a week, which gives us about 60 to 66 live classes. And then we also have on our website all the recordings available for each class for the students who are not able to attend live, given the complexity of life, given the flexibility of the time zones. And of course, you need to spend maybe that particular time where the live class is happening. That may be your family time, right? Or maybe your work time or your personal time. So you can watch the classes on your own convenience. All the recordings as webinars are available on the website. And then you have your quizzes also available on the website. Then there are some already existent webinars, which are extremely valuable information pieces. So you have past batch classes also. If you are moving ahead of the batch and you want to revise some concepts ahead of what is already being discussed, then you have the most valuable content that I really take pride in is the ODEL classes and the therapeutic guideline classes. So I have handpicked about 58 cases from the newer ODEL and the older ODEL. And then we discuss each individual ODEL case and prepare. There are webinars, 58 webinars for those. And then similarly, now this batch we have introduced, and I have covered entire therapeutic guidelines from front to the back, cover to cover. And we have discussed concepts, reading between the lines, finding the hidden meanings in TG, and what each sentence and what each word would mean for the exam. So coming to now, one major question that may come to your head is how the preparation will change. And my answer remains that the preparation does not change for the exam, because you were already preparing for 70 Sbqs before. You will still be getting 70 Sbqs now. And would that mean that you don't prepare for MCQs anymore? Then the answer to that also is no, because MCQs are the building blocks of Sbqs. You
Yeah.
cannot attempt any Sbq without mastering your methods of knowing and attempting and correctly answering an MCQ, because Sbq is also cumulative MCQs, right? Each MCQ answering is an art. You should know how you rule out each options, because they are not very distinct options. You're not used to, they will not give you very black and white options. They would be so gray, your naked eyes will not be able to identify them. So that's how gray the options are. That's how close the options are. And every practical option seems like a correct answer. So judging that and developing the skills where you acquire that skills and acquire that information and knowledge would come from reading MCQs, developing concepts through them, and then applying that to your Sbqs. That is one thing that I totally believe in, because we are not having more number of Sbqs that we were having before. And even if the MCQs, standalone MCQs have been chucked off, the skill required to attempt Sbqs is exactly what is the skill to attempt any MCQ, and it trains you. More MCQs you attempt, the stronger you get. I always tell my students, sweat more in practice, bleed less in war. Okay. So the more you practice MCQs before this, the less you will struggle in the exam, because your brain would be so trained, your eyes would be so trained, and your skills of applying information would be so trained, and it would be like a hot knife through the butter. So that's what it gets. That's how simple it gets. So yes, sweat more in practice and bleed less in war. That's my mantra. Yeah. And yeah, I think I have covered most of what I intended to about the changes and how it may impact your performance in the exam or preparation for the exam. Now I would be really happy to take the questions if there are. So
wonderful.
Look at the chat.
Yes, so I think we have one question from Dr. Astitwa Agarwal. What does B grade mean in the first part of ADC? What does close pass mean?
Yeah, so I don't think it's a very complex way to put it. To be honest, if I would say, suppose it's a 10-mark question, right? A 10-mark paper. So if the cutoff was 5, right? If the cutoff was 5, so if you get 6, it's a B grade, and if you get 7, it's an A grade. Simple as that. It's like how above you were from the cutoff. So if you were within the 10% of the cutoff score, then it's a B. If you were more than 10% of the cutoff score, so it's just a way to feel good about yourself. Of course, if you get an A, that yes, I did my best, and it boosts your confidence for sure for your part 2, because at least then you get an insight about the fact that your concepts and domains were really strong. And you did make good judgments in the exam. Wonderful. And best amongst the lot, that also.
Yes.
Yeah, it helps, because see, ultimately it boils down that it's a competitive exam. You have to have that belief in yourself that you are the best and you deserve to practice in Australia.
Exactly.
Yeah, so conviction is everything. And with your high scores, bring a lot of good base confidence for your part 2, which would come in very handy, I'm sure. Exactly. Deepesh can vouch for that, I'm sure.
100%. There's another question. So clinical cases series books, sorry, questions are coming in now. So clinical cases series.
I got this question.
Did you?
Yeah. So the question is that do they require to do clinical cases books for each individual subject now, because there would be Sbqs only. So now the Sbq is the hero, right? I mean, MCQs were already supporting cast, and now it has been chucked out of the plan entirely. So Sbq is the lead role earlier also. Now it's the only hero. So now I understand you do get tempted that, do I need to do more Sbqs? Do I need to just only do Sbqs? What do I do more that will make me stronger for Sbqs? So whatever we were doing before, at least I can speak for my course, right?
Yeah.
Whatever plan and curriculum we were doing before, we are keeping it exactly the same, because it was well enough equipped for Sbqs only, right? So individually practicing your MCQs, creating base and strong foundation of each subject. That is number one. You need to have a solid concept base. Number two would be applying those concepts to clinical situations. So you may be a good theoretical student, or you may be a very good clinician. But for this exam, you need to be both.
Both.
If I'm making myself very clear and very transparent about it. So you need to be both for this exam. You need to have a very strong grasp on theory, and you need to also know how to apply that theory to the clinical aspect and apply it to the patient individually, and how it will change with given each history. So clinical cases are important, but I would not recommend doing it from various subjects books, because those are postgraduate levels, and ADC does not judge you on postgraduate basis, because the guidelines given in those books would be on the recall basis also. They will advise you that you recall in this much time, you do this surgery. For example, if I'm talking about perioclinical cases book. So that is for a periodontist, right? Because they would be handling the patient first on, not a general dentist. A general dentist job would be to give an initial appointment, initial oral debridement and conservative treatment, and then referring. And Australia is a very strong believer in the referral system. They do not want you to do, as a general dentist, everything by yourself, but rather create a supportive practice of referrals so that the patient gets the best management. If you go ahead and do endoclinical cases and then you do your perioclinical cases, they will be talking about the surgical aspect that goes beyond the scope of the GDC, general dentistry, and also goes beyond the scope of the ADC. Then, because it's a general dentistry exam, even if you are a postgraduate. So clinical cases in ODEL talks about clinical situations, talks about individual discipline, but from a general dentist point of view only. And that's why it would be the most valuable and a limited source. You're not wandering, you're not struggling through so many books, but rather just one place, every discipline is covered.
Yeah. Should we still be going through 1,000 MCQs?
I'm still going to go. So, because the reason is, I have divided my 1,000 MCQs subject wise when I cover them. And instead of going through theory books and concepts like a monotone, I rather try to teach my students the concept through the MCQs. It gives me two benefits. One, the point is made, you get the concept. Two, it gives you the practice of learning tricky language, which ADC uses, getting accustomed to that, finding the keywords, getting accustomed to comparing different close options, ruling out techniques. So we actually kill two birds from one stone. So we get the message across, we get the concept cleared, and we practice the most important skill that you will take with yourself to the exam, which is your ability to skillfully answer MCQs and score the right score, right? So yes, I totally believe they are the foundation stones, and you cannot build a strong building without the foundation.
Sure. Would you provide books and past MCQs to practice?
Yes, absolutely. Everything and anything that you need for the part 1 examination, the course material, the files, my personally compiled material, then all the articles, the references, which I would select, I have handpicked over the years, I would be sharing everything. And when you enroll to the program, you get to keep all the material, all the soft copies. Only the access to the website is only till the enrollment part, like till the time you have enrolled for. Yeah.
Fantastic. Now, one of the questions is, which book is best to refer for SP or scenario
SBQ
questions?
Yeah. So there is no one book actually that you can refer to and be done with it. It would also create multiple preparations. So you, as I said, you prepare each subject from individual sources. So you can do so from various concise books, which are available for various licensing exams. UK has their books, US has their books, Canada has their concise books. So we use any of those because basic concepts of dentistry apply the same throughout the globe, and it's applicable in ADC as well. It helps you to just brush off your undergrad subject. And once you have brushed off and once your base is created, then doing the MCQs, learning the ADC tricks and language, because every exam has its own language tone, right? If you go for AFK, it's different tone, different concepts being emphasized on, and especially emergency part managed in different countries, the guidelines are different. So then coming to the details, of course, there are differences. Overall, it's all same, but some details are different. So TG, therapeutic guidelines, ODEL, doing the materials, studying a subject from a comprehensive source. I think it's a cumulative effect rather than one book. And yes, we have a lot of past scenario-based questions for your reference. That is your most important base, which I have compiled as Mega Master file over the last few years, all the Sbqs asked. So I think doing the Sbqs that has been asked, but also knowing that ADC does change each Sbq language, they change history, they change slight detail and the entire meaning of the patient, and their management would change. So not just knowing what is normalcy or has been asked, but also knowing what may be an aberrant, what may be a variation. So being prepared for that as well. And that cannot come from just one book or best book.
Fantastic. A lot of people might have this question as well. So if I start training now, would I be able to take the test in September, or would you recommend keep studying and do it in March?
So now I started the September course in April 11th, in fact, to be precise. So we are already about 2 months into it, right? And we are left with 3 months. Can it be done? I have in the past, every batch, I get somebody who joins me in the last 2 months. There's always some heroes, right? And do they pass? Almost every time. Almost every time, the ones who join in the last, probably it's because they come with a lot of adrenaline already in their system. And probably they are over ambitious in that matter, that they understand that they are doing it in less time than others and they have to catch up to them. So they're driven by their hormones and chemistry. And that's helpful. And the mind state. So it has been done before. Students have cleared with me in the last 1 month, 2 months as well. But depends how you handle anxiety, how you handle that kind of stress. If you think you perform really well under pressure, then you can go and still prepare in 3 months. I do help those students in tailoring the syllabus. I, of course, tone it down. I don't make them do everything. And plus, because after 8 weeks, I do start revision of the first 8 weeks concepts. And then we go to the Sbq practice. So you still have the live classes where you still be covering those concepts. It's not that I will not be covering those concepts at all. And you will have the past class recordings and as webinars. So you can catch up on your free time. Of course, you will have to put in extra hours than the rest of the batch initially. At least it will take 1 month to catch up. So yes, it can be done. But if you can't handle stress or you curb under pressures, then go ahead, stay safe, take the exam in March. I mean, life is too short, but also not too short that you can take the ADC the next after 6 months.
Fantastic. Which books I can refer before joining the, I don't want to use the word coaching, but coaching classes, so that it supports my preparation?
That's a good question, because a lot of students come to me and they're reluctant to pay for the 2 courses, right? And I totally understand that. Respectable. So what I tell them is, okay, meanwhile, you want to take the exam in March. You don't want to join from now. You don't want to pay for 2 batches, 2 courses. Okay, fine. You join me in October. Till that time, I don't want you to waste your time and everything. So I would say just message me personally. I'll give you the content that you need to study for the 6 months without any fees. There would be no charges for that. I'll give you, and if you need those files, if you don't have those files, I'll give you those files as well. Because I want strong candidates. I want people to have a strong base, because that's like saves my energy and time, right? So if you are strong, if you are doing your job well, my job gets easier. Simple.
Well begun is half done. So
right. So I would definitely give you what all you need to do. And if you don't have those files, I'll give you those files personally as well. You can message me later on and you can contact me and I'll be providing you the material.
Awesome. If a candidate fails in first attempt, would you support for the next attempt also?
Yeah. For that, the answer is straight no, because I cannot know what is the person's motivation and what is the person's reasons for failure, right? Because I know one thing for sure, the person's failure would not be if because I lacked in something, right? Or even I would not say that you lagged at something. It could have been that day's performance that take you down. Because when I take my students with me, I make sure that they're well motivated. They're doing their job 200%, not 100%. I don't believe in 100%. We always go 200% because we know the stakes are high, right? And there's a lot of money involved. It's your time away from your family, your kids. They don't deserve to lose you again in those dump of books for another 6 months. So I respect your time, my time away from my family, your time away from your family. So, well, when there's so much valuable at stake for everyone, I do not support or even encourage the idea that it's okay if it didn't happen this time, we're going next day. My funda is simple. We have to make it in one attempt. And I give my 200% for my students to clear in their first, this attempt, what they start with me, whether it's their first attempt or whatever attempt from the past. But I do my best, and in fact, 200% to help you clear the exam. And that's why I will support you till you decided and committed yourself to take the exam.
Yeah.
I don't know, maybe somebody gets too procrastinated and is not serious then, considering the fact that, oh, I will get assistance for till no matter what time. I cannot commit for an X amount of time, not knowing what I'm committing to, right? So
Yeah.
it's understandable. You would also not commit to something where you don't know what the time frame is.
Exactly.
It's as simple as that. It's a human commitment, right?
Yeah. It cannot be a blank check. It cannot be.
Yes, it cannot be. And it's a human commitment. I give you my personal attention, my personal involvement in your journey. And I cannot commit to your journey for unknown amount of time. Of course, for a known amount of time, if you know that you cannot do this time, then next time, if I'm aware, then yes, there is provision, but not in general.
Okay.
Yeah.
I think we'll have to figure out what this exactly means, but which difference you want to do in your training. So I'm assuming that this question means that
How
what
my course would change.
would be different to any XYZ or anyone else. So
That's Hasti. That's my student.
okay. Okay.
I think so. I think I have one Hasti. So Hasti, is that you? Okay. So I'm not going to change the plan. I may add on few things. I may give you more sources now to strengthen and outgrow your fear of this change. But I think after taking the exam, everyone would figure out that there was not anything to be scared of. And they were already preparing for it from the last 4 years. Whoever was with me, we were already doing it. You can go to any of my ex-students and ask them. I was already following this protocol. We were already preparing for Sbqs and developing that analytical thinking, reading the keywords, emphasizing on mastering your skills on finding history, and also adapting and changing the answers if the language changes in the exam. And I was also emphasizing that if you approach the part 1 in this way, your part 2 does get stronger. And now I can proudly say that so many of my students have cleared their part 2 in their first attempts. And one of the contributing factor to that was the solid part 1 base that we create. So I'm not going to change what has been fantabulously working so far. I may add to it. I'm not going to take away anything from it.
Sure. Can we expect less questions from things like DM and more clinical stuff?
No, I think the weightage to each discipline still remains the same.
Okay. And the last two
DM dental material is absolutely clinical for that matter, what they ask. I mean, whatever, if in case you're asking DM from before or DM in general, then basic sciences are asked less, clinical sciences are asked more. But whatever was being asked, whatever was the weightage of each discipline till March, the weightage is still the same. And DM does contribute a lot to your clinical practice. You need to know in RPDs what works better for your patient, acrylic RPD, metal-based RPD, cobalt chrome for that matter. And then you need to know the nickel allergies, the male and the females, for example. Then you need to know the amalgam and your composites and the contraindications, indications, advantages, disadvantages, because that's not DM to the core. They may not ask you what is the chemical formula of gypsum, if that's what you mean by DM, right? What your basic theory is. but they would definitely ask. So they will not ask you what's all in alginate. They will not ask what is the retarder, they will not ask you those theoretical questions, right? But how the clinically, yes, how hydrocolloid functions clinically, how you will store your impression once you've taken it with alginate, which one's better for undercuts, why would you not prefer it for mobile teeth, things like that. Of course, clinical implications will matter. Absolutely.
Sure. I think the continuation to that question is like things like hydrocolloid. I think you have answered that already. So something in the same lines. Yeah.
So I think there's one question about the fee structure also and the contact. I think we can share the details with you of my contact post this class. And I usually do not give away my emails, but you can contact my website. So I'll give you my website, and there you can click on enroll and or contact us, and I'll receive an email from you. And probably then my team will get back to you on that.
I think if you can, how much would be the course, and how are we going to be in the same level as the other?
So the course fee, etc., will be discussed when you send the form or you message me on the website, email me on the website. And Ariana, I hope you mean that if you join late, then how you can be on the same level as others who started before you. Am I right? Okay. I don't know if you followed from before, as I said that it has been done before. Trust me. And this is the biggest fear people who join late, they come to me with. And I totally appreciate it that they're accepting that they have limitations. Yeah. But I have seen people who join late show such sincerity, such commitment, and they give in extra hours which are needed. I would only say start late. It can be done. It absolutely can be done, because I'll provide you all the tools needed. Yeah. It's just that you need time on your hands. So it only cannot be done if you don't have any time. Yeah. That's the only challenge. So if you have time, if you can give me 7 to 8 hours or maybe more over weekends every day, I can help you plan for 3 months as well. And students have cleared it, I can assure you. Now, earlier I was reluctant how I can tell students that you would clear it, because they're paying me for full course. And then I'm like, it's only 2 months. But now after 4 years of like 8 batches and seeing the results coming out, so I kind of believe in my formula now, that it works, the potion works. So, but again, there is something that I can only provide you, and you have to study and intake it. So your intake and your study hours matter the most. Yes, absolutely. You're going to be paying the same fees if you join now, because I give you everything as recordings. All the classes which have been covered are also provided on the website. So there is no that percentage of joining and when deduction. It's a full course that you get. Even if you're not getting live, you're getting all the webinars which are recorded of the missed classes as well. Other than Odell, yeah, which books should we follow for Sbqs? Again, as I said, that there are no specific books out there yet. So that is why you would rather need to acquire skill than just practice. Sbqs are composed of MCQs, as I'm saying it. And please, I'm putting emphasis on that any MCQ that you practice is a practice for Sbq. Sbq practice alone, different from an MCQ would be, it would be an elaborate history taking, elaborate information given to you, and you will have to connect the dots of an elaborate patient information. So for that, first you need to have absolute mastery of the native language where the exam gets asked in. So that's English. You need to absolutely have command over the comprehension of English. Exactly. That's true. But I mean, in some simpler way, almost everyone can comprehend, but it is none of our first language. Most of us, we don't have it as our first language. And ADC uses very complex way of fabricating their statements. Yeah. Yeah.
I totally echo that. And we speak about that in detail with our part 2 preparation as well. Without sounding any different, we are all immigrants, even me, every one of us, we are in immigrant countries. But the language that they speak in this country is English. So that has to form a part of your preparation. There is no other way beyond it.
Yes,
So it
even
is something that
reading, your
that
speaking,
yes,
everything has to be, you should be able to more than understand more than complex formation of this language.
exactly.
So the simpler levels will not work for this. For this exam, especially whether it's part 2 or part 1, you need to be at a complex level and a more deeper level of the language skill.
Regards to, I think, enrollment, you can contact us or you can go on Winspert directly. Both options are open, and both options
Yeah,
will end up with the same result. So we're more
right.
than happy to help you out as well. Um, what is the amount of fee for the student has to pay for 10 months duration? I think you would say that in a private email, or it would be mentioned on your
Yeah.
website. Is that correct?
I'll send you the course details, some sample classes, and the fees for 5 months and 10 months, both duration, both courses. If you go for 1 course or 2 course, I'll send you the fees of both, and then the sample classes as well, plus the details of what we'll cover, some information about that.
Maybe if you want, Jigyasa, maybe we can ask people who are interested in getting that sample. They can leave their email ID in the chat box if they want. We can make a list of them and send those things through. Up to you.
Yeah, probably, yes, you can leave your emails and maybe we can compose an email
Yeah,
and send
yeah,
them.
and then send them those things.
I think we have covered this, but I'll go through this again. A plan to give exam in March, would it be effective to start now or in October intake? I think it's a personal choice and how confident you are, but Jigyasa, you can fill that in as well. So
Yeah, as I said before, again, it has been done in less time, and some people are. So why do people do it in less time? Let's think about that, right? I mean, what is the rush? So that's why I asked them, first of all, who joins me at this last minute thing in the rush hour? I asked them one thing: why do you want to do it in 3 months, or why do you want to do it in your 2 months? If your why is strong enough, then you will do it.
yeah,
Right? If your why is strong enough, you will do it. Because those who joined me for the last 2 months, 3 months, 1 month, they had very solid whys. I want to clear this September. That's why I want to join for the last 2 months.
yeah,
That is one reason they gave, that they want to clear the exam this September. Not that they want to take the exam this September. There's a difference.
yeah,
Because they were driven to clear the exam in 3 months, start to preparation. I don't know why they have these timelines. I may or may not ask them personally, but they have set timelines for them. Then they meet them. I am not their driving force. They are their own driving force. I just provide them tools and they work on it, and they chug up on the information like something. So that's what you need to be. Are you driven to cover the exam and clear the exam in that less time? If you're not, if you're okay, if you don't have very specific time bound timelines, then I always personally say, don't bring that kind of anxiety and stress in your life. Don't. Take it easy. Take the exam in March. Yeah, my personal advice. But only those who are hell-bent, no, I want to do it, I don't know, I'll do anything that you say. You just tell me what I need to do and I'll do it, but I have to clear this September or this March, whatever it is. Then they make it. I just tell them, do this, do that, and they make it because they do it.
Yeah.
They just do it. So those people are really self-driven, I would say. So if you come with that kind of motivation yourself, and then I'll add fuel to it, don't worry about that. But you need to bring the fire burning in.
Awesome. I think we have had a few emails, so we'll deal with that after, like, once the presentation is a bit over. The one of the questions was, what does professionalism and health promotion mean in ADC new handbook?
Yeah, so this is actually your cluster 1, right?
Yes.
And it's a criteria. So usually your Sbqs, when they start with a question about, they give you sometimes in ADC, now the pattern is they talk a lot about the patient's personal history as well. For example, if I can give you a few examples, there is an ortho case, Zara case, where the patient is poor, comes from a rural background. They don't have a conveyance. They're walking from their farm, and they do not have a car of their own. There is no public transport in the area. And the orthodontist comes once a month, bi-weekly. The primary dentist comes bi-weekly. And you are, as a general dentist, are not confident for a particular treatment. Now that's professionalism, how you will manage that patient. You will professionally manage that patient. You will bring to consideration patient's personal history and will bring out the best management for that patient. So that is professionalism, knowing what are the work ethics in Australia, what should be the guidelines. It could be in terms of the record keeping in some Sbqs. It could be asked in terms of health promotion, like how Australia really promotes prevention more than the treatment, how you should be always opting for the conservative treatments than your invasive ones. All that reflects upon your professionalism and your health promotion attitude. They have some Sbqs about dementia patients in the old care facilities where the patient is not able to maintain their oral hygiene. As their principal general dentist, how you can help them, what should be your attitude towards training the nurses in the community, in those health practices or those old age facilities. So that is your professionalism. That's what your work, that reflects on how you think about not just being as a professional dentist, but rather how you manage the patient with the given socioeconomic conditions. That reflects on your professionalism. Like seeing a patient in your lunch hour, there are Sbqs about that. Then there are other patients waiting and you need to see, and what kind of emergency does that patient come with, where you will keep other patients waiting and attend that, or what would be not so important for today's appointment as you have already seen him and you have other patients waiting. What are your ethics, how you draw the line, where you bend? All that comes, and all that is judged and asked now in ADC part 1 exam specifically.
Awesome. I think there are no more questions. It's a lot of emails, so we'll go through that. And I would really like to echo and add, I keep saying this again and again. If you all like movies, if you have seen movies, it's like a future. So Dr. Jigyasa is with part 1. We are specializing in part 2. And I can tell you, we have been here about 20 years. I have 5 practices. We hire a lot of dentists. We fire a lot of dentists. This is your job interview. You have to approach it like that. You are giving 4 days of your life, 2 days for part 1, 2 days for part 2. And that is how you need to think that you would be a dentist here. And I can tell you from experience, the way we hire has nothing to do with knowledge. It is all about professionalism and how you handle yourself and how each and everything that you read incorporates in your daily life and how you would help your patients basically. So I think that makes a lot of difference. And um, rather than just rehearsing or learning things, it is all the more important for you to understand why you are doing it. As Dr. Jigyasa said, why trumps everything? Why is greater than how or what? So if why is clear, then everything becomes a lot easier.
And all of this is actually making you a better clinician. It's not only about passing the exam, you have to practice as well after that. So you basically, it's all setting foundation for you
Yeah.
to be a better clinician anyways. So
Fantastic. I think there are no more questions. Anything else you would want to add, Jigyasa?
Yeah, I think I've covered most of the vital points that were needed. So I think with the questions also we got to talk about on some uncovered points. But yeah, I would ultimately end this with that, that there is no one book. So just eliminate that idea. There are no shortcuts for something too great in your life. There are never. So you need to sweat it out.
Yeah,
You have to get the amazing results. I
exactly.
mean, sometimes things can work out and you may get blessed with something
Yeah,
non-random, spontaneous, but that is also because of some past work that you did.
yeah,
So it is a force doable exam, both your part 1 and part 2, I would say. I have been seeing tremendous success stories now in the past. I can confidently say that, at least for my students who I know, who I receive messages from, it's absolutely doable. And but what the effort that it needs to be put for the life that you desire, and the quality of life that you desire, and the quality of practice that you desire ultimately to do, right? So it's not just about being in a beautiful country, but being able to practice, at that optimum level where your heart desires to. So I think dentists do not crave that the fancy, the first world things, but rather that environment and the freedom of practice that comes with it, the quality of dentistry that they can practice there. So it's a well-deserved opportunity, but it requires given amount of effort, which cannot be bypassed. With there should be no shortcuts. So you just be open to it and like just accept it. Okay, hit me with anything.
Yeah.
I am gonna do it.
Awesome.
So no matter what, if you decide, I will only come out of it once I have got my ADC license, then there can nothing that can stop you.
Yes.
It's your conviction that takes you to the success.
Okay. No, awesome. That answers a lot of things. And it you have to be mindful of the long-term vision. You are
Yes.
doing this to practice in a country different to your country. So you need to jump through the hoops and do whatever you need to do. And first of all, you need to understand and believe that no one here is wanting to fail you. No one wants you to fail you. They just want the best out of you. So
True.
on that day, in that week, in the past 3 years, you are judged on all three aspects. On that day, in that week, and on the past 3-4 years, whoever has come before you. So give your best on that day, do whatever you can, and hopefully everything works out. And if you are clear with your concepts, and I'm pretty sure it would. There is no quota. There's nothing of that sort. If we are not here in Australia as overseas dentists, they wouldn't have dentists to work with. They don't graduate so many dentists. So there is no such thing as they want to fail you. It's not an easy exam. It is a fair exam. It is not something that they are out to get you in any shape or form. Same with part 2 as well. If you are clear, if you are professional enough, if you behave like a dentist, you all are already, it would show. And that's how us and Winspert are on the same level, and that's why we have collaborated, and that's what is our driving force, because we don't believe in just churning out or giving shortcuts to anything. There are no tips and tricks. We are all dentists. So if we work together, it all works. And just 1 second.
Yeah, we'll unmute you.
Sorry, I'm just trying to.
Yeah, thanks about that. Yeah.
All good.
Yeah.
And yeah, I think it's all good.
We can
We will quickly go through the rest of the slides, and if anyone has any questions, please keep putting in the chat box. This shouldn't take long, maybe another 5-7 minutes or so. So I'm not too sure if all of you or most of you are in Australia at the moment or everywhere else. I'll just give you a brief overview about part 2 as well. So Kanika can go through that quickly. So
Yeah, so what we do, I mean, again, as Jigyasa has her course as well. So with part two, we also do A to Z, everything that is required for part two preparation. So we in a moment we're going to talk about how it looks like, but if some of you are interested, we can anyways, and once you pass your part one as well, we can anyways talk a bit more detail about that. We do have people who are looking for or who might have passed part one and are looking for part two preparation. We have a orientation for specific for part two as well. So if you are interested, we can do that as well. So just a quick overview of how part two looks like, so that you have a bit of more idea about what's next after this. So just to give you an overview, so we can.
So essentially, Part 2 also is on 2 days. 24 nowadays with COVID, it's a bit on and off, but 24 candidates on 2 days, group 1 and 2. So day 1 is technical skills day and day 2 is clinical. And they judge you on all the criterias. We'll go through that, but it is very specific.
So these are the
These are the
tasks
technical tasks. So 3 preparations and 3 restorations
on the technical
on the
day, and
technical day.
then OSCE.
And communication and technical law skills, what we were discussing for your part 1, that's why it resonates. So our main aim of putting this in with the part 1 orientation is essentially for you to understand and realize that everything is connected. If your part 1 preparation is solid, it will make it so much easier for you to do part 2. It will make it really, really simple, and
Yeah.
you would be thankful for that.
Yeah, your OSCEs and stuff, because you'll have 6 communication scenarios. Rest of them would be skilled OSCE stations where you'll be timed for 10 minutes. You kind of have to see 10 patients on that day, if give or take. So basically you have to do it could be LA, exo, previous slide over the page. It could be LA, exo, CPR, managing syncope patient, writing a report, scaling, matrix band application, rubber dam application. So 4, you'll have performance or skilled OSCEs, and rest of 6 stations you will basically be talking. And again, as we were talking about the clusters and things, similar to what part 1 has now introduced. So the next one would be, again, your clinical information gathering, diagnosis and management, and clinical treatment and evaluation. So again, they are divided into clusters. So you have 2 cases of discussion of role plays with the examiner, so total from each cluster, and then you have some skilled OSCEs to perform.
Yeah, there's a question which is quite relevant, and it is quite relevant in these times. There's uncertainty about Australian borders being closed. If we pass part 1 in September, how will we manage to pass 2 in 3 years time duration if borders don't open soon? So this is a question that no one has an answer to. um, the borders are something that no one can control. It is something that would depend on a lot of external factors. But the way we see it in terms of immigration and in terms of everything else, they cannot be shut forever. It doesn't work that way. We have families there, people come and visit, there's tourism, there's exams. There has to be a way in which it would open. It might not look the same, but it would be a way to do that. Will it be vaccination? Will it be quarantine? Will it be time bound? I don't know. No one can give an answer to that. But essentially, if you have the aim of going out and practicing in a different country, certain aspects have to be done. So as long as they are asking you to do part 1, I think they
Yeah.
know something that we don't. So it is going to happen eventually,
Yeah.
but in what shape and form, we don't know.
Yeah, because what they did with last year, so people who basically, appear like, their part 1 was expiring in October, but
Yeah.
since there were no exams the whole year, they ended up giving them some extension. So their validity for their part 1 expiry was increased. So they were given those many months that they lost last year. So they gave them extra time where they could still appear for their part 2 exam. So if that kind of thing happens, so probably depending on your circumstances, your
Yeah.
scenarios, you could be in the similar position where people will get extension of their expiry as well.
Yeah. And we would in due course in time, like right now in the subcontinent, it is really bad with COVID situation, and
Yeah.
we have had a lockdown here. So things keep constantly changing. It is hard to predict that. Just in general, I think it's true for part 1 and part 2 both. Common causes of failures: inadequate preparation, casual attempt, overconfidence, incorrect guidance, over preparation, wrong study sources. In a sense, both part 1 and part 2 would factor in this. And in terms of what all is needed to prepare for the exam, obviously passion, thorough understanding of the exam process, which you are getting today, willing to put in the hard work, as Jigyasa said, time from daily lifestyle commitments. This is an exam which is which happens while your life happens. So it is something that you have to make time to do that. Appropriate guidance, I can't stress that enough. Physical, mental, and spiritual strength, family support. By the time you are done with the process, your spouses, your family, they would be half dentists. So it is something that you need to be prepared for. And obviously a little bit of luck. So that's there. About guidance, you're already here. So, that's a good start. And we went through that. I won't go through that again. Um, a big no-no, and this is again probably similar to both part 1 and 2. Don't give breaks between the study flow. Have a time frame and understand how much you can put in. Stay away from negative social media. Surround yourself with positivity. These are the three main things that we have seen helps people. And have a timetable. As Jigyasa said, if you are prepared for it, she would help you weekly, monthly, however long you need to make a timetable and help you get through it. And same is with us as well. And why Dental101 and Winspert? We spoke about that. We want to make you good clinicians. We want to help you get good jobs. We want to make sure that you are part of the Australian framework and you are doing whatever you can in order to fulfill your dreams, basically. And all our instructors and mentors are Australian practicing clinicians and specialists as well. And we provide all the solutions for your journey. This is not very relevant for part 1, but we do have loops as well, which would be required for your practical classes or practical part 2. That's our mutual student. That's Dr. Lena. Jigyasa would know her. And why loops? Just briefly, because your preparations are being judged by people who wear loops. So that is a plain and simple answer. And these are just some of the things. Now, this is something that I wanted to put across, and we'll end really soon. Anyone who is in Australia, who is going through the process, we firmly believe that having some, don't look at the dates, it's an old flyer, but being in the workforce is the best way for you to attempt and do this exam, part 2 especially. And for that, we have a dental assisting course as well. We have combined 18 months of knowledge in probably 2 days, and that would make you job ready. That would help you in understanding the daily routines and how you can be in the workforce. And that helps a lot with OSCEs. Trust me, part 2, it is an amazing thing. And you earn money as well while doing that. Just a few snapshots from our DA course. We cover a lot of things. And this is something that Jigyasa and us do get a lot. This is for part 2, and I'll quickly go through this. When someone asks that, what is your success rate? I can speak about part 2. So this is directly from the ADC handbook. What that means is that in 2018-19, probably the successful number of candidates were 176, which was 13%. And then the year before, it was the year after, it was 19%. Now, at this point in time, I can guarantee you that any student who has gone through the whole process, very rarely it is only from one source. So the success rate is the students, the success rate is not what and where they are doing it from. It is a combination of everything. Out of the 176 students in 2018-2019, we have a record that about 138 to 142 have been through us in some shape or form. Out of 180 students, about 158 or 162 students have been through us in some shape or form. So, be it they would have done the full course, they would have taken some guidance. Everything matters, everything helps, because that is the end goal and that is what we are trying to do. So the success rate is something that we answer it in this way. Even if you don't have that question, I thought I'll put that in. um, Anything to add, Jigyasa? Do you feel, you know?
No, I think you covered it really nicely, Dipesh. And actually, students do come with a lot of questions when they start for part one. They already have questions regarding part two. I had it too myself, because we are kind of, we are overachievers. Dentistry has made us like that. We kind of like to be prepared ahead, and
Yeah.
that is a nice approach. That is also very good professional quality, right?
Yeah.
Managing a patient, waiting for another patient in your waiting area. So I think you kind of plan ahead being a dentist, and it's a good way that we have now. ADC has also made it so coherent that people can now form very strong links between part one and part two. Earlier, there was just this belief that just kind of manage clearing the part one,
Yeah.
and we'll see main the part two what it is all about. Now I think, and but I was already emphasizing, right, that you need to have a very solid part one preparation. It breaks down your part two effort to many times,
Yeah.
many times.
Makes
If
sense.
your part one was a fluke, then you struggle in part two, then you slog.
Yeah.
So, and finally now ADC has come out and put the same terminologies
Yeah.
on the judgment and the skills required. So it actually helps people to understand that part one is so important, and if you do it right and if you do it amazing, I mean, not just good enough,
Yeah.
but if you do it really well, your part two is half already done.
Yeah.
So then you just need to practice and gym it out. Simple.
Exactly.
So it
Uh,
becomes that easy.
well said. There are a couple of questions. So, yes, we are based in Melbourne. No doubts about that. Very close to the exam center, probably 8 minutes walking. Um, you are more than welcome to visit us and come over for courses. We have students coming in from overseas when it was open and all through Australia. But we are based in Melbourne at this point in time. We have a center in Mumbai in India, but that is only for part two. And obviously, with whatever is happening in India, it is very, very tricky right now. How many months you need to prepare for part two? It's $1 million question. Everyone's different. We have had first timers who did not have a home support, who did not have a home setup. They just practiced with us and they have passed. So there are all kinds of stories. um, do you suggest we work as a dental nurse for ADC prep? 150,000%. Yes. It it will open your eyes to a lot of stuff. It is important. It is not that you have to do it, but if you're motivated enough, it does help. There's no two ways about it. um, we are based in Melbourne, and yeah, as I said, people do travel to us, and that's how we do that. Where in Mumbai and what is the course duration? So if you, Sneha, if you can leave your email, Kanika can get in touch with you. How much would a home setup cost for part two? We can go through that as well. We have a part two orientation, and we can do that. Which visa people usually apply for part two? Various visas. Right now, there is
No
no visa,
visa.
but once it's opened up, you can do it on a tourist visa as well.
Yeah.
All right, let's get through this. Sorry. Yeah. And then the money question arises. I just thought I'll lighten this up, but yeah, money is something which is relative. You invest in yourself. You don't give the money to someone. You invest. You have listened to us, you have heard us today, and you understand what we are all about. So money is a relative term in that aspect. Kanika will go through this quickly and then we'll end.
Yeah, so we have a YouTube channel as well. So as a lot of people, like, there was a transition between old TG to new TG, when they sat for their written exam. And then when they had to give their practical, so of course they had to use new TG, new version of TG. So we have quite a few videos, and if you want to see how we do things, what, how we teach and things like that, to get a bit of an idea, we have a lot of YouTube like videos on our channel. So if you want to, you can like or subscribe and things like that, and just to give you a bit of an idea about things. So yeah, that's pretty much it.
That's us. And thank you so much. Thank you, Jigyasa, for being with us early morning. And thank you
No,
for
thank you so much.
all the wonderful
Participants, yeah.
participants who have been with us as well. And we'll try and
Yeah.
get in touch with you through whatever means that you have sent us, and
Yeah.
that should be good.
And if you have any questions, feel free to call us. That's our number. And or if you want to contact Jigyasa for something, feel free to have. So we'll share the list of
List over.
emails that we've got with Jigyasa as well, so we can then send the information accordingly. Good. And yeah,
Thank
have a
you.
good day. Keep practicing. Keep working hard. Wish you all the best for your upcoming exams.
And hopefully see you soon in Australia.
Yeah.
Thank
Thank
you.
you.
Thank
Thank you
you.
so much, Jigyasa.
Thank
Have a
you
good day.
all. You too. Bye bye.